The Federal Ministry of Health has pledged to implement the recommendations and summary presented by the Joint United Nations Mission to Nigeria on tuberculosis and non-communicable diseases. Minister of Health, Dr. Osage Ehanire, pledged that the federal government will effectively implement the recommendations to reduce the burden of tuberculosis and non-communicable diseases in the country.
The mission came to support and strengthen coordinated policy, strategy, and programming in the fight against NCDs and TB, which both feature prominently in the Sustainable Development Agenda of the United Nations. It will help monitor progress towards attainment of Sustainable Development Goals, and specifically this vision was aimed at strengthening multi-sectoral coordination framework for NCDs and TB.
Dr. Clement Peter, officer in charge of World Health Organization in Nigeria, said the agency would support Nigeria in implementing some of the recommendations. Peter, represented by Dr. Rex, said the implementation of recommendations will help to reduce the burden of diseases in Nigeria. Earlier, Ms. Diana Will, lead strategy, World Health Organization Global Tuberculosis Program in Geneva, gave their summary and recommendations from the meeting.
Access by the whole population to the really innovative and effective diagnostics, treatment approaches, and prevention tools, as well as broad societal tools for prevention, is increased. So the prioritized strategies and new technologies can drive real results soon. We also know that a multi-sectoral response, as per this mission we've discussed with you in your own actions, needs to be further galvanized. It's certainly clear that more of government at all levels can be involved with clear responsibilities and roles, and a whole of society approach involving all the partners we've met can make a big difference, both for the ownership over the actions to be taken and the accountability for those actions.
For his part, Mr. Dudley Tarleton, Program Specialist, Health and Development, United Nations Development Program, said lack of public awareness on these diseases, including among healthcare workers, was a major barrier.
This is one thing that came up, making sure that the vulnerable populations are affected, refugees, migrants, old people, people with low incomes, that they get the same treatment and sometimes get extra support to leave no one behind. We also talked specifically about what the UN can do amongst ourselves. We had such good buy-in from the UN colleagues here, how the UN can push forward collectively to help you address these two disease groups. And I think some kind of a coordinating country working level mechanism would be good for the work that we've aligned out here. We also started this week on the investment case that Nick mentioned earlier this morning that's based on NCDs, but because of this work, we're able to include some on tuberculosis as well.